This is an instructional video using the Saphena Venapax EVH system. In this video, I'm demonstrating my newest technique, the pullback for taking and cutting branches. I'll demonstrate that among a lot of other tips in this video. I like to start by creating space anteriorly for the trocar. You can find the vein using a tip search or just, METs, whatever you prefer. But once you do find the vein, go up about 4 inches up the thigh and create space for the trocar so that when you go in with the device, you will easily find the vein again. And then here I am going down the leg, creating space anteriorly for the trocar. Again, I go about 4 inches. This leaves me room to put the trocar all the way in if I like. And the vein is right there. So to begin, I go back to the trocar and then gently get underneath the vein, trying to stay out of the posterior fascia. On both sides. It's important to do this because at the end of the case, you'll have very little to do once you pull the vein out. So I begin by going under at 6 o'clock. Here's a branch that I wanted to take. Now, any small branch like this or adventitia, I take by moving forward or using the ping twist, demonstrated in other videos. So again, I like to go posterior first, and I get my tip right at 6 o'clock. And notice that the score that's on the point of the conical tip is 180 degrees opposite the vein. Here's a small arterial that I probably should have cauterized right then and there because it created some bleeding. However, in this video I'm going to demonstrate how to handle bleeding so that you can keep your tunnel dry. So here's a posterior branch, making a window, and I thought that I could cauterize the bleeding and take the branch at the same time, but I was only able to take the branch, and I had to go back and cauterize the bleeding. So with the pullback, I'll cauterize the branch starting at the end of the electrodes, move forward, continuing to cauterize so I get a good seal. And then when I'm at the crux of the blades, I just slide back real quickly, and that cuts the branch after it's been sealed. Now I have a little bit of bleeding here, and this happens a lot where you have some bleeding and you try to take care of it right away, but you can't see very well. And I can't see very well here, so what I like to do is continue up the tunnel. This cleans off the conical tip, but then it opens up the tunnel, so now you can see the bleeding better. My branch is not bleeding, it has a good seal. Clean off my tip, and now I can see where the bleeding's coming from, and I take care of it. So when you have bleeding, don't be afraid to continue up the tunnel, posteriorly or anteriorly, and then come back. And it's easier to take care of the bleeding at that point. The tunnel is more open, and you can see the bleeding more clearly and identify exactly where the bleeder is. Here's a small bleeder in the wall. Here I'm demonstrating what plane you should be in. Okay, you want to keep the conical tip off the vein. That's on the vein. That's too close. That's the plane you want to be in is down here. That's the correct plane where you're not compressing the vein too much. So the vein sits at the top of your screen. It shouldn't be in the middle of the screen. And that's the correct plane to be in. I'm trying to leave a little bit of vasovasorum adventitia on the vein and not strip it with my dissection. Okay, here's another little arterial that's crossing. I'm going to take care of that later. Here I come back, I start my anterior dissection. And just create a small window for these branches. I tend to dissect a little bit too much still, but ideally you want to create a small window. Here I have my conical tip right at the base of the branch. I'm going to go in, cauterize at the end of the electrodes, advance back to the crux of the electrodes, and then pull your blade in, and that cuts the branch. It happens very quickly. So when you pull back with the slider, it's a quick pullback. There's a little bit adventitious still on this branch. I'm going to take this by moving forward. So all the adventitia I'm taking by moving forward. My branches I'm taking by doing a pullback. And I'm having great success this way. Here's some more adventitia. I'm going to take this by advancing forward. This way, the branch or the adventitia is always in front of you. It's always in vision. Here's a little more adventitia, and take that. And I really want to keep my tunnel dry the whole time. So when I do my anterior dissection, I like to do a little bit of a 12, 2 o'clock, and 10 o'clock dissection on either side of the vein by pushing through the adventitia posteriorly. I'll begin by going 12 o'clock first. Here again, there's a bleeder, and I'm going to try to take care of it. I'm going to get a little bit of cautery on it, but I can't see it really well. So I cauterize it, and then I advance past the bleeding to clear my view and identify the bleeding more clearly itself. So here's the bleeder. I can see it better now. I'm cauterizing a couple spots. Clean off my screen, take another look at it. Have a little bit more bleeding there. I really want this tunnel to stay dry. It's worth the time while you're doing your dissection to take care of bleeding. It'll save time later. Now I'm ready to take the adventitia, which I like to take by just advancing forward with the cautery on and Pac-Manning the blades. And because I was at 6 o'clock the whole way on my posterior dissection, my vein is sitting right in the middle of the tunnel with equal amounts of adventitia on one side, which makes it easier to do your anterior dissection. Here again, I go up around 12 o'clock, and then I do a little bit of window at 10 o'clock and 2 o'clock. Send my blades out and cauterize and cut the adventitia, leaving a lot of it on the vein. Here's a nerve that's attached to the vein. I'm just going to get my conical tip in between the vein and the nerve, preserving the nerve, keeping it intact. I like to get underneath the vein for my last sweep and hit any adventitia that still may be attached to the vein. Got a little more length on my first pass down the leg. I like to not do my stab and grab. I go down the leg first. I don't do my stab and grab because CO2 can leak out of that stab and grab when you go up the thigh. So I'm not going to do a stab and grab till the end of the case here. My tunnel's dry, just gaining a little bit more length. The vein looks nice here. Taking a little more adventitia. Here I'm using the conical tip to elevate the branch, or in this case the adventitia, which makes it easier to cut and safe for the vein. A little more adventitia here. And my tip is always off the vein when I'm taking branches or adventitia. Here I'm just checking to make sure I'm free, because I had that nerve that wrapped around the vein. And it looks like I'm free here. That looks like it's off the vein. So the tunnel looks good. I took care of my bleeding, and now I'm going to do the thigh dissection and branch taking. So I've created space, and I'm going in to start the posterior dissection. And again, you do this gently, carefully. Just get just underneath the vein and between the posterior fascia and the vein. Again, you want to be right at 6 o'clock, and you want to keep the score 180 degrees opposite the vein. I leave that branch because it's elevating the vein for me. And again, the score is going to be 180 degrees opposite the vein during your posterior dissection and anterior dissection, because that's the most gradual part of the conical tip and shaft. Where the score is close to where the window is, where the blades come out. So I keep that off the vein. So again, I want to keep this vein right in the middle of my screen. I want to be right at 6 o'clock. If I have to, I'll cauterize any little arterial so it doesn't cause bleeding later. So just made a little cautery on that arterial, and continue keeping the vein right in the center. I'm right on 6 o'clock. My score is at 180 degrees opposite the vein, so I'm not rubbing the window where the blades come out against the vein. Again, the plane that I'm in is below the vein. You want the vein sitting up top of your screen, not in the middle. And I got off a little bit from 6 o'clock, but went back. So I'm staying at 6 o'clock. If I need to, I move over to the left or over to the right to keep this vein right in the middle of my screen, right in the middle of the tunnel. So here's a little arterial I want to take care of. Probably did a little bit too much dissection. You always want to be proactive with potential bleeders. Take them when you can see them. So I sneak in, trying to cauterize this little arterial. That last push, I created a little bit of bleeding. But it's no big deal. I'm going to take care of it now. I'm going to use the same technique. I'll try to cauterize this now, but I'm going to advance up the tunnel to clear my view and come back to it where I can see it more clearly. Come back, now I can identify where the bleeding is. It's actually over here on the wall. I do a little more on the bottom of the tunnel, but it's actually over here on the left side. I'm going to get over there after I clear my view, do some dissection, come back. There's that bleeder. I can see it clearly now. Identify it and cauterize it. So when you have bleeding, don't be afraid to advance up the tunnel, clear your view, come back to it. It'll be easier to take care of. Here I'm checking my tunnel again. Looks like I see something over there on the left side of the wall. I'll take care of it and advance. Looks pretty good. So I started below the knee, and with the new Gen 4 device, it's longer. I can go all the way up to the saphenofemoral junction on this patient, and I was able to get 50 centimeters of vein. Staying exactly at 6 o'clock, my score is 180 degrees opposite the vein. I'm not seeing many branches. So I come back, I'm looking for branches, I'm looking for bleeders on my way out. And I notice a couple right there. There's a little bleeder in the wall, I'm going to take care of that. Just going to clear my conical tip off, come back slowly, check for bleeders, check for branches. And notice a couple branches right there. This is just a little vasovasorum branch. Tiny little window. These low profile blades will sneak in nicely. You can cauterize and cut the branch. Now the way I take branches is I just use the tip for dissection. Just a little bit with the tip. I put the tip at the base of the branch and my score at a 45-degree angle. Now I know my blades are going to come out right on that branch. Look at it right there. It really is an efficient way to take branches. Here I'm going to cauterize, do my Pac-Man a few times, and then a quick slide back on the slider. And that pullback technique works great on branches. So because I did my posterior dissection and I stayed at 6 o'clock the whole way, my vein's sitting right in the middle of the tunnel with equal amounts of adventitia on one side. It's not being tethered to one side or the other, which makes it more difficult to harvest. Okay, here I try the pullback, and occasionally it doesn't cut perfectly. And what I've been doing is just do a quick advance now. I'll use the ping twist and a little bit of an advance, and it really just takes a tiny bit. It's already primed from the pullback, and the branch cuts easily in view with just a little bit of motion and a little bit of twist. So here I'm taking the adventitia on both sides. So I put my tip at the base of the branch, put the score at a 45-degree angle, counterclockwise to the branch. Okay, here I'm going to just cauterize. And that branch was just set up to take just by advancing a little bit. So try to use the blades to take adventitia most of the time. This way you leave that adventitia on the vein. Again, by staying at 6 o'clock during my posterior dissection, the dissection anteriorly is a lot easier. The vein stays centered and it's not tethered to one side or the other. Got a little bleeder there. I'm going to take care of it right away. Just want to keep this tunnel bone dry. You want to be very militant, diligent about keeping your tunnel dry. It just makes for a more enjoyable experience harvesting the vein. So you see my score, it's 180 degrees opposite the vein. This way the window where the blades come out is off the vein. Again, I just go up 12 o'clock, 2-3 inches. I come back, take the right side, come back, take the left side. Here I'm using the conical tip to elevate the adventitia away from the vein so I can cut it and cauterize it more easily. I'm always advancing through adventitia. I don't use the pullback on adventitia, just on branches. So here I'm going to use a little counter traction. I use my free hand. I'm going to push the fat down into the conical tip to get this branch that's really kind of stuck to that wall. I'm completely off the vein. I'm just working on the branch. Here I make a little, I go up the tunnel a little bit to see if I can gain some length that way, and I do. I gain some length by going up on top of the vein just a little bit. Okay, here's the pullback. So I cauterize in view, always at the branch in view, and now I'm going to pull back quickly here. It's very quick, and this is going to cut the branch. Just like that. Now you're all set. If there's a little bit of adventitia, you just push through that with your tip or your blades and keep going. I like the pullback because I can see the branch the whole time during the cautery and cutting. A little bit of adventitia. Going to take that. Some more adventitia. Again, my score is at 45 degrees counterclockwise to whatever I'm cutting. And that shows me where my blades are coming out. So use the score to improve your efficiency. You'll waste less time coming out with your blades and having to spin them around and try to get onto the branch. So I'm always at 45 degrees counterclockwise with my score to pretty much anything I'm cutting. So you see any bleeding, take care of it. You want to be really diligent about taking care of any bleeders you have. And now I'm just going to take care of a little bit of adventitia. Another squirrely branch. Looks free now. Again, I go up 12 o'clock, 2-3 inches, come back left and right. You have a branch. And here's a good example of when the pullback doesn't cut everything. Here are my tips on the base of the branch. That way my blades don't come out in the fat. I'm at a 45-degree angle. And here I just get into too much fat here, I think, with my blades. And when I do the pullback, it doesn't cut. But the one thing I like about the pullback is if you get bleeding, and I'm going to get some bleeding here, it's attached to the branch and it's easily addressed. With the other techniques of cutting, sometimes you lose sight of where that bleeder might be after you've pushed through. So here, after I did the pullback, I just went back to it and advanced a couple times. And here I have a little bit of bleeding, but it's attached to that branch and adventitia. I know where it is, so I take care of it. So I'm still perfecting the pullback, but it's easy to address any bleeding if when you pull back you have a little bleeding or you have a little bit of adventitia still attached. It's easy to address. You just do a quick cauterize and advance and it's taken care of. Here I'm making sure that the vein's free. And it looks like I am. That's just some posterior adventitia and fascia. Score is always at 45 to where I want to send my blades out. My anterior dissection has been easy because I kept my posterior tunnel dry and I kept the vein right in the middle of the tunnel during my dissection. So I think that's really important. The plane that you're in, where your tip's not on the vein, and keeping the vein centered at all times while you're dissecting really makes the case more enjoyable, more efficient, more easy to do. Again, my score is off the vein. So I've noticed that on this medial branch, the posterior or the pullback works really well. I'm pretty close to being done with my dissection. Here's a large medial branch, and I'm just going to clean the tip off here. And I have nice length on that. I probably could stop my dissection there, but I'm going to go ahead and cauterize this fascia or this adventitia. Notice I stopped here because my tip was under the branch and my blades were over it. I don't like that. So I got my tip and my blades over that branch. And then I took care of the adventitia that was wrapped around this branch. And again, I just used the advance or the ping twist to take care of my adventitia. So here I line up, scores at the base of the branch, 45-degree angle. My blades are going to come out right where I want them to be. I begin my cautery at the tips and then move towards the crux. And when I don't see any more spray, I'll do my pullback. And here's the pullback right now. I have a tiny bit of adventitia on there, no big deal. I'm going to just cauterize and cut in advance with the branch in view. Completely dry, large branch. I really am starting to like this new technique of taking the branches. So I needed a lot of vein. This was going to be a case with 4 vein grafts. So I removed the trocar and went in with the scope, and I'm able to get to a couple more inches of vein dissected out and get a little bit more length. So I go up a couple more inches, anterior and then posterior. Created a little bit of bleeding here, so I'm going to go ahead and take care of that and take care of the adventitia that's on the sides of the vein, and then I'm all set to go. So I like the length of the new Gen 4. I like the lower profile blades. I think with these longer blades, I'm able to simply slide the slider back and take my branches with the pullback. If they don't cut, I just go and do a quick ping twist and I'm all set to go. The branches are a little bit drier this way and they always stay in view. So here I'm ready to do my stab and grabs. There's a little bit of adventitia still attached to that one branch, maybe a little bit beyond it. I'm going to take that with my blades, always keeping my score at 45. And there I'm ready to do my stab and grab. The case is over.